Hey friends, I'm Dr. Molly Brinkman. I'm a veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. So welcome to the Dr. Molly Says podcast. I have a friend. This is Dr. Betsy Grunch, and you may know her online as Lady Spine Doc.
That's me. My birth given name.
We are recording this for the second time today.
We're happy to see you again, but you didn't see us the first time.
Yeah, so we're having a fun day. We had lunch and she's here hanging out, saw the building, and we got about, 20 minutes in, and
we're just doing a second take. We're just,
memory card crapped down.
Yeah, it's fine. Everything's fine. We went to Walmart. We almost got hit.
Yes.
In your car.
A lot has transpired. But here we are.
And we survived. And
we survived. So if you see this, it means this worked and this recording happened. So welcome, Dr. Grunch.
Thank you for saving me and bringing me back.
Yes. So if you don't know Dr. Betsy Grunch, let me tell you about her. I got her medical school bio. So she's a Georgia girl.
Go Dogs. Sorry.
She did that last time too. And she went to undergrad at the University of Georgia, grew up in Georgia, and then went to Medical College of Georgia.
Correct.
Okay.
It's no longer called that now. It's Augusta University now, but they've changed names a million times. So
we're going to call it Medical College.
Mm-hmm.
And then she did her residency and fellowship in, what is the actual name? Neurosurgery?
In neurosurgery.
Okay. At Duke.
Yes.
Cool.
Yes.
And then tell us, we talked about this last time.
I'm in Duke colors.
Yeah. Oh, you are in Duke colors.
Know, except for the orange. We'll cover that up.
Yeah, that makes it like Florida.
Yeah, it does.
Ugh.
Gross. We'll both agree on that.
We can agree on that.
Yeah.
Ew. Yeah. Okay, fellowship. Residency was 6 years.
Yes.
Which we talked about already.
Yes. We talked about how 6 years is now neurosurgery is 7 to 8 years, but I did my residency during the pre-80-hour work week. Mm-hmm. So I worked up to sometimes 120, 130-hour weeks. So it was like a shortened version of residency crammed into less time. Yeah. So, yes.
That's happening with vet schools now, too. Did you know this?
Really?
Yes.
Spreading it out and making it longer.
Not making it longer, but the vet students are like trying to get regulation for hours when you're in clinics. And a lot of vet school programs are now, they're in clinics for longer. Like when I was in school, it was 3 years of classroom and then a little over a year of clinics. But now a lot of schools are like half and half. So they're in clinicals for like 2 solid years. Uh-huh. And so I think that's all has to do with it, but they're getting regulation.
Yeah. I think it's a
good thing.
I think it's a good thing. Degree. Yeah, for sure. For sure. There were times where I don't even know how I survived my drive back home from a shift. So. Yeah.
I know it's worse on the human side, of course, but I mean, I think I did one time work, I think for like 48 hours straight.
That's a long time.
It was I was like on anesthesia. Yeah. And I was like on call and I got called in and I was in, I think back surgery, like an emergency something all night long. Yeah. And then had to like work the next day. And then I think switched rotations to nights. I don't know. However it happened, it was like 48 hours, but I know that happens or used to happen a lot for human med. Yeah. So. Yeah. Okay. Residency for 6 years, fellowship for
1 year.
1 year after that.
Well, it was actually enfolded. So I completed my residency and fellowship in 6 years, which was crazy. Yeah.
That's the crazy part.
Yeah. That's the crazy part is I integrated it all and was done pretty quick. So that's good. Yeah. Good for me. I looked out. I was grandfathered into one, but yeah.
Okay. So. Yeah. And I love the reason you became a neurosurgeon. So tell us about that.
So I wanted to be a police officer. My mom was a cop, and I thought she was just a badass. I mean, like seeing her put on all of her uniform and speak in the microphone, listen to her like wrestle down criminals. It was pretty badass. So I really thought that was kind of like what I wanted to do. And then she was in a car accident when I was 2 weeks about to start freshman year in high school. And the injury left her instantly quadriplegic. And so that experience with her being a normal bodybuilding police officer to being instantly, having to have every portion of her life being done on someone else was extremely catastrophic, obviously for her, but for everybody in our family. And it just changed my world and really made me look at things differently. And I wanted to be a caregiver. I also wanted to understand neuroscience and like why something like that seemingly, injury could just do that. And that's it. And there's no other alternative. And I wanted to cure spinal cord injury. So that was my goal.
And there's still time.
There's still time. There is. But
and you became a caregiver for her.
I did. Yeah. So I, like I said, I was a teenager, and I mean, as a quadriplegic, you can't eat on your own. You can't go to the bathroom on your own, bathe, clothe, brush your teeth. So we learned as a family how to care for her. And that even means overnight. You have to turn people so they don't get pressure sores every 2 hours, weight shift, all those things. So that meant someone had to be literally up 24 hours. So we would alternate shifts, and me and my stepdad. My brother was young. My brother was 5. So yeah.
So it was just
me and my stepdad. And it was a workers' comp injury. So there was caregivers that were provided, but, there were times where that wasn't, someone didn't show up for work or whatever the case may be. The shift wasn't covered, that, we had to care for her. So
yeah. Crazy.
Yeah.
Changed everybody's life.
Yep. Yeah.
And she's awesome. And
she's still, that was in 1994, and it's now, 30 something years later, and she's still with us. She's now in her 60s and is, harassing me still and pissing me off like all moms do.
Perfect.
Love you, Mom.
Happy Mother's Day. This will be later, but it was just Mother's Day.
That is right. But no, she's just an amazing human, and really loves us, loves animals. She actually is one of these, for all the vet med people will probably love this, but she's one of these crazy social media people who shares the dog's about to undergo euthanasia and to save them. That is her mission.
She's a rescue gal.
She
I
is.
love that.
So she shares cross posts, tries to arrange all this stuff. Yeah.
What's her first name again?
Betty. Yeah, Betty and Betsy.
Betty and Betsy. I love it. Betty, our rescue queen.
She is. Her life mission is to save all dogs.
Oh, I love that. Does she have dogs right now?
Yes. Yeah, they have one dog now.
Okay.
Mm-hmm. But rescued probably, I don't know, thousands in her life. That's all she does every day. Get up, get on social media, share dog posts.
Did you have dogs growing up?
Did. Yeah.
Always.
Labs. Black labs.
Oh,
I know.
We do.
I know.
I mean, that's what I have now, but
I know.
My parents always had a lab. Mm-hmm. So always.
We actually had Dobermans when I was little. 2 Dobermans.
Dobies
yeah,
too.
They were
really
great.
Do.
And then we had black labs, and and then when I went to college, I didn't have any pets, and then I met my husband, and now I'm a Vizsla girl. Yeah, I've had 5.
It's quite the trajectory.
It is, right?
Dobie, lab, Vizsla.
That's right.
I don't know. I think that says something about you. I don't know what it is, but but I love it. We're going to talk about the dogs, of course.
Yes.
And now you're doing something very exciting.
Yes.
You have started a practice. Tell
us
about it.
Yeah. So had the opportunity to start my own practice in neurosurgery, and I was able to basically practice in my hometown without a non-compete, and open up practice taking care of my community in the way that I've always wanted to, independent and spending the time with my patients and providing them the care that I feel that they deserve, treating them like family. And it's been 3 months now, and it's been the best move I've ever done. I wake up, I go to work every day. It's my people there, and it's just a feeling that I can't describe. It's awesome.
I'm so happy for you.
Yes.
And we're in the building where I'm hoping to do the same thing.
Yeah,
it's very exciting.
Yeah.
And that is Southern
Neurosurgery.
Yes, neurosurgery. Yes. Oh, so exciting. And it's only been 3 months.
3 months. Isn't that crazy?
It's so new.
It is new, but we're busy, and
so much goes into that. I know.
I've learned so much about medicine, organized medicine, EMRs, like contracting,
insurance.
It's crazy.
Yeah.
It's a world that I thought I understood, but as a practice owner, it's totally just, it's insane.
Yeah.
So,
yeah. And even more complicated, I know, than like all the things we do. So
Yeah.
I can't even, it's
y'all,
complicated enough.
Everything's
on the
complicated.
vet side, but all the regulatory stuff, I
Yes.
think is when we don't deal with all the insurance stuff yet.
The insurance stuff, I think, is the biggest thing.
Yeah.
I mean, you guys have,
Because
all the
ours is
stuff too,
still
but, yeah.
client pay. Like
Right.
they file with insurance, and for the most part, they pay. Insurance reimburses them.
Right.
Still
Right.
for now.
Yeah, I wish we could do.
We should keep it that way, right?
You should keep it that way.
You heard it.
Trust me.
We need to keep it that way.
Trust me.
Yes, that could be its own episode. But I'm so, and I not to get on an insurance tangent, but as a human patient, I was in a like health sharing program, like a Christian health sharing program.
Yes, Medishare.
It's Christian Healthcare Ministries is the one I used. There's a few,
Yep.
but to all the doctor's offices, I was a self-pay patient.
Yes.
And then I would get reimbursed.
Very similar to how vet insurance
It's
is.
very similar to vet
Yeah.
insurance. And so then I would get reimbursed from the health share program. But in the human hospital, I would get like anywhere from 70 to 90% discount on all the services as a self-pay patient.
Correct. Yeah.
And so like all three of my babies I had under that program. And so when you have babies as a self-pay patient, you get like an 80% discount.
But it just shows you the upsell of what we have to do in human medicine to even get paid what we deserve.
Yes.
Which is insane.
It's crazy. It's
insane.
crazy. And like as a veterinarian on that side, I thought about like, gosh, this is wild how much they have to pay just to get paid. But it was a lot of work, but I realized like it was cheaper for me to do that than to pay for insurance.
Yeah.
It's crazy.
Yeah.
Like just to be a self-pay.
Yeah. I mean, there's pros and cons of everything, but we need some type of change.
Yeah.
And on the human med side.
Yes.
So.
And vet med needs to not go the way that human med
Learn
did.
from our mistakes.
Please.
Learn
Yes.
from our mistakes.
That seriously is. I didn't mean to go on
Let
that
us
tangent.
figure it out, and then we'll
Yes.
share.
Yes, I know.
Yeah.
I hope it gets better.
Yeah.
People like Dr. Potter are trying. To
Yeah.
raise awareness about
Yep.
it. Okay, sorry, back on track.
Yes.
All right. So normally I ask guests to give like a hot take. So I kind of warned you that we would do that because since you're not in veterinary medicine, but you have a lot of like vet experience lately because of all the
Yes.
things that have been going on.
Yes.
I figured you could come up with something that has to do with the vet animal world. So if you have a hot take, you can share it with us.
I would say my hot take is being a person that has a pretty, I think, extensive knowledge of education and healthcare and navigating systems, but just really not understanding the scope of what veterinary medicine is. I feel like I never really understood what general vets do and the modalities of how you treat, how you bill, what you need to know, your knowledge base. And like the more I've become friends with you, understanding your practice, taking my dogs to the vet, and understanding that like you guys like have to know a ton of knowledge like about every specialty, every breed, and it's really like quite impressive, I think. And
Thank you.
I mean, I'm just
glad
saying,
you think so.
like to know, what I know about neuroscience and humans, to know. Like you guys have to know all of it in every breed, and that's just, I mean, it's incredible. And so
It's a
I'm
lot.
impressed.
Well, thank you. I feel like we're kind of like the Renaissance people of medicines. We have to know at least a little bit about a lot of things.
Yes.
But there's
y'all know a lot about a lot of things.
We know a
you
lot.
don't have to do surgery and
we do
dental
know,
work.
we do know a lot about a lot of things.
Yeah.
Okay, fine.
Like let's
we
give
know a lot
credit
about a
where
lot.
credit is due.
Yeah, like a day in GP veterinary medicine can be crazy because especially someone like me, because I'll literally see and do anything that I need to. And we have specialists, which is something a lot of people don't realize, is that most human specialties exist in veterinary medicine. And they're wonderful, but because this is like a more of a cash client pay system, so many of our clients can't go to specialists.
Correct.
And so, it's me or nobody in a lot of situations. And I'm a vet who's willing to try and do a lot of surgery and things like that. So
in human medicine, we don't get a choice, right? Like if I
Yeah.
see him and I'm like, you're complaining about your dizziness and I think it's the heart, I'm not even going to talk to you about that. You need to go see someone else and that's it. But, you know, like you said, for pets, I mean, like most people can't afford or, you know, just don't want to
go elsewhere.
do that. Right.
Right. And a lot of them just, I mean, specialty care is really important. And,
Yes.
you know, some people will be mad at me for saying this, but specialty veterinary medicine has priced itself out of a lot of people's hands. And it is because we have brought veterinary medicine so far. Like what we can do is quite amazing. Like the
it's
technology
incredible.
and the level of care, which you've experienced, which
Yes.
we'll talk about. But a lot of people can't afford to pay for that. Is it worth it? Yes.
Yeah.
It's actually a lot less expensive than the same kind of care in human medicine. But when a lot of clients are cash paying clients and they don't have insurance for their pets, they just can't do it.
Or travel. I mean,
Yeah.
you know, specialized veterinary care is not like getting a cardiologist in every city. You know, it's a lot of times it's traveling. For me, even, you know, we have to travel an hour and a half just to see anyone besides a GP, and that's hard.
Yeah, because
So,
people have to miss work
Yeah.
where they make money to
Right.
pay for their vet bills.
right.
So yeah, so someone like me who does a lot of surgery and will see a lot. I mean, I could see kittens and old dogs and heart dogs and cancer dogs and dermatology dogs and do 5 surgeries on the same day. And
Yep.
it's just crazy.
Yeah.
I love it. It's my
Yeah.
favorite thing about it because I like to do all the things. But I do think a lot of people don't realize what all we do. So I know that veterinarians everywhere will love to hear you say that because and you know, a lot of our clients do work in human medicine,
Yeah.
and a lot of them don't really understand.
No, it's
how
a
much
different
it is.
world. And yeah, I mean, I've definitely experienced so much in the past year. I've gotten basically like a
Crash
trial
course.
life, yeah, in veterinary medicine, and it's really amazing. So I'm excited to talk about it more.
Yes, so we should talk about our like friendship origin
Yes.
story because it has to do with dogs. Yeah. So do you want to tell the story? Do you want me to tell the story?
I'll tell this
This is how it
yeah.
started.
Yeah, this is how it started. So I have Vizslas. I'm a crazy woman that can deal with these Velcro animals. And Pancake is our older Vizsla. She's 13. She's, I mean, like the epitome of health. Our other dogs have been, you know, little medically challenged, if you'll say, but she's been the one that's always like the picture of health. Never had any issues. Never taken a dog, really just for her checkups, and that's it. And so I was in this whole, I'm still on a fitness journey, was incredibly counting my macros, doing all this stuff. So I made like 5 chicken breasts in my Instant Pot and had it shredded up, was sitting it on the island to let it cool off and out all my dishes to prep for the whole week. And I went upstairs to put my kids to bed. And I came back down and the Instant Pot was in the same place, but all the chicken had disappeared. And I was like, what the hell just happened? So we have cameras everywhere because my husband is in security consulting. So we checked the cameras and Pancake had like danced around, somehow tilted the pot enough to eat the entire chicken breast, and then that tilted back up. And
Like the aliens
it
took it.
it was quite impressive. The video was. So I shared that video on social media because I was impressed. But then I got to thinking like, okay, well, that's not normal for her. And so we were at the vet. I mean, she was still like a month or 2 away from her normal checkup, but Butters' ear was bleeding because he has this freaking ear issue and murder scene all over my house with the head shaking. And so I had taken him to just get it evaluated. And I just mentioned to my vet that Pancake it's been seemingly more hungry, more panty than normal. So she screened her for Cushing's disease, which we found out she had, and was started on Veteril.
Yes.
And started on a dose that was really high. And so she immediately went into Addisonian crisis. It was super terrifying to me because like she essentially like almost collapsed, and the whole experience is like very traumatizing to me. So I was more or less just putting a video out there to like ask like if that about the medicine, because I had no experience. She was older, and yeah.
So insert Dr. Molly says.
Insert Dr. Molly.
So we did not know each other at the time, but I followed Ladies.
Yeah.
Ladies Find Dogs,
Yes.
but we have a mutual friend, Lindsay Scrub Hacks.
Yep.
You should follow her too. And I was seeing your posts, and I just had this internal like red flag going off, like the math is not mathing here. What she's saying is happening doesn't really make a whole lot of sense.
We were asked to treat with steroid.
Yeah,
like
so
giving back.
because of this, well, the thing, because the Addisonian crisis was suspected, but not
Correct.
like confirmed with
Correct.
any diagnostics. But you're a doctor, so you like had an idea about that, and so then it was like, let's start steroids. But then like, just
was
not a lot of thorough
guidance.
follow up about it.
Right.
So anyway, I texted Lindsay and was like, I don't mean to be like this kind, like an a-hole, but I feel like what's going on with Betsy's dog doesn't make sense. And if she wants like an outside opinion, I'd be happy to help her with that. I also have a podcast episode on Cushing's if she wants to listen to it, and dogs. So anyway, she connected us.
Yes.
And so you listened to the podcast.
I did. I was very educated on Cushing's disease. I learned things about Cushing's disease I never knew about in dogs.
Yeah, it's very endocrinology. I think is so interesting, and it's
hate
cool.
endocrinology.
Well, I did in school, but now as a doctor, I love to treat those things. And so we talked, and then so I kind of encouraged Dr. Grunch to just sort of either get a second opinion or just talk to her vet about like, okay, what's the plan now? Because they stopped the Vetterel because of the scare with the Addisonian crisis.
Yeah.
And then I think kind of where the rails went off, you did end up getting a second of going elsewhere because.
Yeah. I mean, I'm, and I don't want to, everybody practices medicine differently. But I didn't feel like I was being heard, and I wasn't, and we had been with this vet for like 13 years, and there had been some things over the years that I wasn't quite sure about, but I'm the kind of person that like very loyal, loyal. And I felt very guilty about like getting another opinion. But when we did, I realized that maybe we like weren't getting all the options necessarily. And so it was really like, I do think that the suggestions that were made really saved Pancake's life. And you empowered me to seek that opinion and to ask the questions that I was worried about asking because I didn't want to hurt feelings. And it led to more diagnostic tests that led to finding a liver cancer.
We really
it went down a rabbit hole, but it saved her life because she ended up getting surgery. And if I had waited, the vet at the University of Georgia, which I cannot say enough good things about the University of Georgia Vet School, they have helped us so much over the past year. But the surgeon there said if we had waited even 2 more weeks, her cancer would not have been resectable. Yeah. So that was a year ago. And she's undergone now 3 surgeries. Crazy.
Because they also found
a gallbladder tumor. They resected a liver tumor, and then in the screening to follow up after she had that surgery, they found a new growing stage 3 sarcoma.
Yes.
And that was resected, and she just finished the 5 cycles of doxorubicin chemotherapy at 14 years old.
And she's thriving.
And she's great.
And people have given you crap about treating her as an old
dog.
Like
I don't even know. I'm a horrible human being for putting an old lady through this treatment. And I'll tell you, like, I would have thought that would have been crazy before, but seeing her able to go through this, I mean, she's done great. She's done great. And
and the whole thing, this is something a hot take I say all the time is not all veterinary medicine is created equally.
Yeah. I agree.
Which can sound
it's like that in human med too.
Yeah, of course. But I think what's unique in the vet world is that when someone like even you, a neurosurgeon goes to a vet, you just, even as a medical professional, you want to trust what someone's telling you. And I think 99.9% of veterinarians all have wonderful intentions, but having worked in the field for so long, I do think there are some veterinarians who, usually ones that have been doing it a long time, that are, they kind of feel like if it's not broken, I don't need to fix it. And so the way they approach things or treat things doesn't change a whole lot with medicine changing.
And there's a lot of I mean, in human med too, like evidence-based care and newer treatments that, I mean, medicine is innovative. Vet med, human med, things change on the daily, really,
Yeah.
and recommendations and suggestions. And so if you're not up to date on the latest research, are you really giving your patients all the options?
Right.
And as I found out, I wasn't getting all the options that I chose to do with a different provider.
Yeah.
And I was happy with, the decision that I made, because it really has changed totally, like, the health of my pets. And I think if I hadn't have done that, she would not be here now. And, and that's ultimately what happens to a lot of pets, I think. And, I just can't thank you enough for doing that, because you saved Pancake's life.
It makes me so happy.
And
it's been so cool. I know, like, the vet world online has loved seeing it, because you've talked a lot just about how much wonderful care you've gotten at Georgia, and like what excellent, really up to date, high level care. I mean, she really had
and
all
even just
kinds
like
of stuff.
breaking down vet med, and like, I think there's a lot of people that villainize vet med because of the cost and how expensive it is. And to be honest, like, it's not crazy expensive considering what we go through in human med. And I mean, I've been through the ringer on both sides, but it is, I mean, y'all go through so much to be crucified for, I mean, you have to euthanize pets and go through some of the worst times with patients and their families and the best times. And then just to be turned around and villainized for asking for your fair pay is insane.
Yeah.
And it's just, we don't really get that we do, but in a different way, where, we're painted as greedy in human medicine for acting for a fair pay. But to be honest, like, you're highly trained, you went through vet school, you sacrificed your 20s. I did the same, loans out the crazy. And we sacrificed a small portion of our lives and to do what we love to do, and to be victimized for being paid for what we do, and our level of professionalism is not really fair. It's not. And the weird thing, I think, and you can correct me, but like, we don't treat other professional fields like that. If an attorney wants to charge you for 15 minutes to answer an email,
correct,
are we going to villainize them? But if a physician wants to answer your MyChart message and then pay for that, or bill the patient for that, we're, greedy. Or I don't know what it is in the vet med world, ask for chest x-ray, anything. That we're doing it because we want to make money. No, that's not what we're trying to do.
The like hot thing people say right now is that their vet upsells them. So that's the big thing right now I read online, is like, oh yeah, every time I go to the vet, they upsell me. And you're
a car salesman.
Yes. That's what they think. And they think we're like having these meetings in the morning, like, okay, if everybody sells an extra vaccine, you get a pizza party or something. Like,
paid by Big Pharma.
Yes, that's not what happens. But that's like the thing right now, is that we upsell. And I do think the vet world is weird, because we're like, everybody says 10 to 15 years behind the human world. Yeah. In a lot of ways, like with the way we can treat things, and we get your leftover drugs. Like a lot of our medications come from the human side of research. Like, it failed a trial, and so then vet med gets it, and like, there's probably 20 JAK inhibitors on the market for atopy in humans, like allergy, itchy. We just had our third one come on the market in vet med. So like, we're behind, and I think public perception of what we do hasn't caught up with what we do. Yes. And so like, when we talk about specialized medicine, there's a small percentage of people who can afford to have specialty treatment of their pets, and they understand the value of it, and they're happy with it. Yeah. But we're in this like weird in between, I think, where a lot of people can't afford that. And that's unfortunate. And maybe one day that'll change. Maybe
it'll change.
I hope
it'll change.
All veterinarians want to take care of everybody's pets.
Yeah, I mean, you don't go through your life and dedicate yourself to saving animals because you're making money. I mean, there's insane. A lot
other ways you
can
make
better
a lot
ways
more money.
To make money than doing human med or vet med. And that's what I tell people that even insinuate that people going, you cannot do what we do every single day, and the stresses and the burnout and the the emotional like waves that you experience in healthcare if you're doing it for the money. There's just no way.
No. Yeah.
Yeah.
Yes. I mean, I could think of like 10 other things I could do to make more money that would have required a lot less education.
Yes.
But we all, human medicine, vet medicine, the vast majority of us are just doing it because we care. And our mom was paralyzed when we were 13 or, you know, we grew up taking care of animals and just want to help their people. And so we get dehumanized for sure as professions.
There's no reason to think that someone that loves their job but also needs to be compensated for their job. And I think it's just this like dichotomy in healthcare where people expect that we need to do things because it's out of the goodness of their heart, and it's not like that in any other any other field. So
I want to be like, I became a vet out of the goodness of my heart.
So
you're welcome.
Yeah, exactly.
Yeah, and the emotional toll is real, and I can't even imagine, like, your job is that way, of course. It's different, but
it's same though.
Same but different.
Like I go in a room if I'm on call, and I have to tell a patient's family that their loved one has had a massive stroke and will never be the same again, and there's nothing I can do to help. And then turn around and walk out and then go into the next room about someone, you know, that just has a little back pain and is complaining about it. Not both patients deserve the compassion and empathy, but the drastic change in the emotions that can happen are overwhelming, and you have to learn how to emotionally deal with that, process that. And it's the same in your world, right?
I mean,
going from
a euthanasia to whatever else we do.
But I think it's, I don't know, I just couldn't, there's so much that happens in the vet world that I don't think I can wrap my head around. Like, so people in medicine and human med, like it's very rare that you find someone that doesn't want to save their loved one. They want to do everything 100% all the time because it's being paid for, right?
And because they can.
And they can. Yeah. And there are laws and rules and EMTALA and things where as physicians and as hospitals, we must provide care for patients regardless of their ability to pay. And everyone wants the best for their loved one. Almost everyone. We're in vet med. That's, you know, that would be hard.
It's hard. For me. And that is,
knowing that you could do something, but
yes. And I think that's the, like, at least what I feel is one of the bigger emotional, ethical burdens is that we have to, you know, we wrestle with that with our clients. Like, we don't like, of course we don't like when that's the case, and we don't want that to be the case. And we have to be very creative, and we have to think of, okay, they can't afford what we know is the best thing to do. So now what are we going to do? You know, or you have $150 and you need to do $1,000 worth of diagnostics and treatment. So how are we going to get this patient taken care of? And then when you add another layer of, it's kind of like, I mean, it's a lot like pediatrics because you have a patient who can't stand up for themselves. Yeah. And so we are standing up for the patient with their owner who's paying for their bill. So it's complicated. Yeah. And I can't imagine doing what you do and like giving people bad news about their human life all the time. Yeah. But it is hard. And euthanasia, the act of euthanasia isn't hard for me. Like, it's usually a gift for patients, like ending their suffering. But the human baggage of euthanasia is what's hard for me. Just like witnessing people's worst day, you know, almost every day. That's hard.
Yeah, you're right. Yeah, I think that's the part that I think is difficult. I mean, we deal with that too. Sure. And it's so
And then the
sad.
Transition from that to like the next appointment.
Then you got to go home and take care of your kids and, you know, and do all the things and act like nothing bothered you.
Yeah. Yeah. So
Mom
we have
had a great day at work.
Yeah. It was fine. It was fine. How was work? It was fine. It was
good.
Yeah.
Great day.
Yeah. But my patients are nicer probably than your patients overall. So that's a good thing.
I would say your patients give you more kisses than my patients give me.
Now, some of them do want to bite me, but I know it's not because they're mean. They just are scared or whatever.
Correct.
So
Right.
But they do have humans attached to them. But I can take them away from the humans.
You can separate them and do what you know.
Yes.
Yeah, exactly.
Okay, so let's talk more about your dog. So, okay, Pancake had liver resection for her tumor.
Yes.
She had her gallbladder taken out because it looked abnormal.
It looked abnormal during the liver
and
resection.
it was like, what was it?
It was a leiomyosarcoma.
A leiomyosarcoma.
The first identified in a dog is what my vet told me. I don't know if that's true, but there's been no case reports of that particular cancer in the gallbladder in a dog. So
a Vizsla would be the first.
A Vizsla of mine would be the first. That's what neurosurgeon said.
Yes.
Of course.
And then her body wall, was it a soft tissue sarcoma?
Yeah. So we had the leiomyosarcoma and liver resection. I think was it hepatocellular?
Yes.
Yeah.
Carcinoma.
So they felt like that was all curative and, essentially recommended serial CTs. And so actually ultrasounds, but then after they resected her tumor in a big chested Vizsla, all the organs were in the chest. So then we realized we need to do CT scans. And so at our 6-month scan, there was a mass on her chest wall that had grown significantly. And then they thought it was kind of close to the liver. They didn't really think it was metastatic, but it was local. And so they had recommended resection. I really weighed heavily on, she was, 13 and just underwent a massive surgery and recovered and was doing well. And I thought, gosh, do I really want to put her through yet another surgery? I talked to you about it.
I even was like, because they were like, we should do a rib resection. And I was like, really?
Yeah.
But they got it.
They did. I elected to do the resection. They resected several ribs around it, a wide local resection. And it came back as a stage grade 3 soft tissue sarcoma.
Yeah.
So shock.
Girl's a survivor.
Now she is. She's got
and then she had chemo.
And then the chemotherapy question came up because of the risk of metastatic disease. And so I thought, well, hell, I've already put her through all this and she's been fine. Why not? Why would I stop now? Right. So
that's a big misconception. People think they hear chemo and they think about humans going through chemo and losing their hair and being so sick, and it just usually isn't the case in dogs.
What I really appreciated was, I told what's happening to my pets online, and so much criticism for even wanting to treat my pets at her age, and I felt like kind of guilty, but my vets really, they're so knowledgeable, and I'm like, I'm not trying to do something to my dog to make her suffer or that I want her here because of some kind of guilt, for myself and keeping her alive for making her suffer. But I really want what's best for her. And so what do you think? And if this was your dog, what would you do? And those are the questions that people ask me. And so having those candid conversations is really important to me. And they allowed me to make the decision. And I thought, okay, well, I'll put her through one chemotherapy treatment, see how she does. Because I was told that chemo was tolerated much better in canines than in humans. Mm-hmm. And after one treatment, there was a day where she was not great, but then she was fine. And so I was like, well, we'll go through it. So she's done all 5 cycles now and is rang the bell a couple weeks ago. So here we go.
I loved that video.
It was so cute.
Ray rang it, didn't he?
Did.
With all the dogs.
Well, my husband, I was at work and this is her last chemo and the vet called me and she's like, we usually do like a ring the bell ceremony. We don't have to. I was like, no, we have to. And I called Ray. I know. I'm like, we must. And I told Ray, I was like, okay. I didn't tell him that was an option. I said, they're going to do this ring ceremony. So
would Ray have said no?
Maybe if there was a choice, because he's a little, maybe because he had all 3 dogs. And anyway, so I asked the oncologist to record it, and she did, and it was great. It was cute.
So cute. And there were 3 dogs in that video.
There were.
Let's talk about the other dogs. So you have Pancake and Butters.
Yes. Yeah. Butters is our 5-year-old. So as we're Molly, I don't even know where to start with this.
And then Butters.
Oh my God. Butters is your typical Velcro Vizsla, very emotionally attached. Pancake is an independent woman, not like a Vizsla totally. But so when Pancake was going through all these treatments, she was hospitalized for several days during her first surgery. And Butters just like panicked. He had this, like, after day 2, he started panting. I called you in a panic.
Yeah, I remember.
Yeah.
I was afraid he had like a
bloat.
GDV. Yeah.
Yeah. And he was panting heavily. He was like unwell. His stomach was dilated. I think I sent you a video and you're like, I'm worried about this. Take him to the vet.
Yeah.
So I'm sure I'm like embarrassed of how emotional I was, but I'm like driving through traffic, Butter's in the back. He's panting. And like, I'm like, he's this close away from death. And I pull into the vet emergency hospital, sling the door open, carry him in. I'm like emotional, crying. Oh God, please save me. I even called him and they brought him in, did all the tests. And they're like,
he's fine.
He looks good.
He's stressed.
But he was still like very febrile and they wanted to observe him.
Yeah.
So Pancake was at UGA. So I checked him out, AMA at this vet hospital, took him to UGA. Once he saw Pancake, fine. And then our vet at UGA said, it's just, he was just like,
stressed.
Yeah, he's stressed out. He's stressed out.
The most Vizsla thing I've ever heard.
To put me through several $1,000s of diagnostic tests to tell me he's having an anxiety attack, that's a Vizsla.
He's stressed. That's what's wrong.
He missed his sister very much.
And so didn't he like hang out with her there for a couple days?
Yeah, he spent the night there, overnight stay. That was great. And then we came home and so then 6 months later after all this stuff, Pancake then has this sarcoma and Ray, my husband, notices something on Butters' jaw. This is crazy, y'all. I can't make this stuff up, I promise. So they aspirated it, and at the time of when Pancake, we found her sarcoma, this was a sarcoma on his mouth. And we had that resected the same day. She had her surgery. He had his surgery on his jaw the same day. And I had been so like overwhelmed with Pancake's diagnosis. I said, can you just scan Butters? Like, it would make me feel better. I know this makes no medical sense, but I just need a body scan on him. And they did. And then Lord and behold, they found another mass on him. And so he had the jaw surgery. That was a grade 1 sarcoma. Good. We had to go back and resect it. And then this other mass that they thought was a sarcoma that turned out to be, I forgot what it was. It was something benign. Sweat gland.
Oh, yes. It was, I can't remember.
It was something.
It was something benign, though.
It was benign, but I had gone a
remember.
big resection on it, and it was,
Yeah, they had to get really big margins. Big old margins. Shark bite.
Yeah, so now he's got this massive incision. So
then
5 cancers or 5 masses, 5 surgeries, 2 dogs, and then we realized that we needed a dog to replace. Not replace. That sounds weird. It sounds morbid.
Well, okay, I know what you did. Butters needs an emotional support housemate, and so you did not want to risk when Pancake goes, like him not having a friend.
Correct.
And why not add a third Vizsla to the mix? So
I've always wanted a third dog, and this is the only way I can manipulate my husband into getting it. So now we have 3.
Now there's Margie.
3. Now we have Margie, and Pancake's going to live another 7 years, just so we have 3 dogs forever.
Honestly, I hope Pancake lives to be 20.
She'll be as white as that cup.
Yes, correct. I saw there's a little dog in France, apparently, that just turned 30. Who knows if it's true, but I saw a post about it today.
Well, according to my social media fans, I will put my dog through anything to keep her alive. So
I know all my senior dog vet people out here.
No, they've been
rolling their eyes because they agree that she's doing great. She's thriving. She loves life. She's hanging out with Margie.
Loves the baby. Hates the baby. Yeah.
And the kids love the puppy, right?
I mean, she's the best. Puppies are great. They're evil and
like a human baby.
Yeah, I mean,
sort of
great. My husband treats her like he calls her the baby, so he hasn't left her alone in 4 weeks. He has this whole theory on puppy training and how he's slowly weaning her into the crate for longer and longer durations of time, supervised, and
that's good.
It's a whole thing, so
that she like gets used to being separated from him.
Correct,
because she's probably attached already.
She's very attached, but we put Butters in the crate day 1.
Yeah,
when
crate
we got
training
him.
is good.
Yeah,
it is.
But
good.
He's convinced that the way Butters is because of that, and I can't convince him otherwise.
Well, I can't either. I've tried to convince Ray of things on the phone. He's like, meh, okay.
Yeah, nope. So
whatever
he just doesn't understand that male Vizslas are just they want to be in your skin. Yes, all times.
Yes. And Margie is so cute, and she's how many months is she?
She's 14 weeks.
She's 14.
She's a little baby.
So she's about to be done with her baby vaccines. And
I'll take her this week for.
Have y'all decided when you're spaying her?
Man. So this might be another hot take.
Yeah.
But Pancake got spayed at 3 months because we were
3 months.
Yes.
Oh.
So another like whole vet story. When I was in residency, we were told by our vet at the time that 3 months would reduce her risk of breast cancer.
Was it 3 months or 6 months?
No, I think it was like 3. It was little, maybe 6. I don't remember. It was very young.
I bet it was 6 months.
Very young. Maybe you're right, but it was very young, and she now has had incontinence ever since this early spay.
Yeah.
And
yeah,
we didn't let her go through the first heat or anything like that, and I didn't know any better. I just listened to what was suggested. They told me it was much better for her, but I think it was easier.
That's what we recommended.
Yeah,
because it's changed in the like vet community because of research that's come out in the last few years.
Okay.
So that's what, I mean, I wasn't practicing 13 years ago, but that's what I would have told you.
I just
10
want to say it
years
was
ago.
even younger though. It was really young. She was she was little.
Someone told me the other day that their doodle breeder spayed their doodle puppies at 6 weeks old.
Oh, Jesus.
Had their vet do it. She was like, is this normal? She's like a wonderful follower that's been following me forever. I was like, no, that's not normal. I mean, this was like 10 years ago.
Yeah.
I was like, did you have an option? She was like, no, like she came to me spayed. I'm like, what vet is doing that?
Wow.
So surely they're not doing it anymore.
Yeah.
But yeah, that's another thing that, like when we talk about not all vet med is the same. There's just so many things that are evolving and changing. Like there's this FIP, feline infectious peritonitis, which is a coronavirus in cats. It forever we did not have a treatment for it. So if we diagnosed cats that were sick with FIP, like we euthanized them because there wasn't a treatment. And then a few years ago, this treatment came along that was like on the black market. Like you literally, if I diagnosed a cat with FIP, I would just be like, I don't have a treatment for you. There's this Facebook group you might want to look at, and people would get the drug on the black market. Well, now it's FDA approved for cats. And so now there's a treatment for FIP, but like but it's very new.
Yeah.
And there's no like email that goes out to all veterinarians, right? They have to be
up to speed,
getting education and keeping up with these things. And so like I keep hearing these
you talked about this on social media?
Oh, I'm sure I have at some point. Yes.
Yeah, because I want to say I've heard you talk about it. But that's the thing I think about, like going into social media and why people like you are so important, and me sharing information and research is kind of talking about these things that are up to date, so then people can learn from just their phones.
Yeah. I mean, and as a veterinarian, I learn things from my colleagues on social media that I like, oh, I didn't go to that lecture at that conference. I wasn't at that conference. I haven't heard about this. This is so interesting. But like I keep hearing these sad stories about vets euthanizing cats with FIP because they literally don't know that like they can just prescribe the treatment for it. Yeah. So it's just another one of those things. But the spay neuter conversation has changed. It's evolved. It's complicated. But I was just curious, like, have y'all talked about?
No, I haven't even thought about it, to be honest. I'm making sure she doesn't piss all over every piece of furniture in my house, which she has.
And so you should. So my recommendation probably would be to let her have at least one heat cycle. Yeah. So now you get to go through that.
Yeah. Oh God.
Have you ever?
No. Yeah. Never. Pancakes has been our only female. We've had now 3 males.
Oh, are you a boy dog person?
No, but like we've always wanted a balanced, boy and girl. And my husband's when we got together, he had a male. So Pancake was our first female, and she's still alive. So we've had 3 males since because we've had bad luck with males. Boys. So we've had many males, but Pancake never went through her cycle. So I don't know what it's like. We'll find out.
Yeah. I have some diapers here you can have.
Oh boy. Can't wait.
It is a complicated conversation.
Yeah.
There's a study, UC Davis headed it up, and they like made recommendations basically based on research for certain breeds. And I can't remember what the Vizsla one is, but I want to say after 2, maybe we can look after this.
Okay. Do I need to have a talk with her about periods like my mom had a talk with me?
You're a woman now. Yes, you should definitely have a talk with her.
Traumatized in middle school.
You should put some pads in her backpack when she goes to school so she's prepared.
Yeah, perfect.
No, it's not that bad. People are always like, oh, they're going to bleed all over my house. It's not that bad.
Yeah.
And there are diapers for that.
Yeah. She'll be cute in a diaper.
I'll send you with some.
Perfect.
A couple more months. She's going to need it.
Oh, boy.
Okay. We could talk about the dogs forever, but we cannot. I do want to, but before we have to go, I do want to talk about all of your dogs. So y'all, Margie.
Yes.
And her origin story.
Yes.
It's really sweet. So I want you to tell us about Bobo and Monty and all of that.
Yeah. So I mentioned that when my husband and I got together, he had a Vizsla, 5-year-old. His name was Bobo, and he was the most amazing dog. I didn't know what to think about having a dog. Like, we never had dogs sleep in the bed with us when I grew up. We had dogs, but not like literal, I don't know. I mean, our dogs slept in crates and stuff. And so Ray, like Bobo, slept with Ray. And so that whole, like, I understood like what Vizslas truly were, like under the covers.
Family members.
Yeah. No, yes, exactly. And so he was the best dog. I mean, just listened to anything Ray said. So fun story. I'll make this very brief, but Ray by trade is a private investigator.
Yes.
And so in order to, let's say, surveil people that have cheated on their spouses or are workers' comp and, maybe faking an injury, you put GPS trackers on cars. You are in places where maybe you shouldn't be. And so he trained Bobo to sit and stay and key words to get him to come so he could have an out. Like if he was somewhere else, he'd be like, oh, I'm looking for my dog. Bobo, there he is. Come. And so he would stay, and he was very well trained.
I need to have Ray on the podcast.
I know. Ray is a dog whisperer.
Okay. Yes.
So Bobo was incredible, just incredibly smart. And anyway, so when we lost him, Margie, when we were looking for dogs, Margie is actually a bloodline of Bobo from the same breeder. And so when we were looking for a third dog, kind of looking for a third dog, we knew that this breeder had like a part of Bobo, and we couldn't really pass that up. So even though we were thinking about it, we had to. So it's kind of she's very special.
And now you live with 3 Vizslas.
Now we have 3 Vizslas. And a little aside, as one of my good social media parasocial best friends, also a Vizsla person, she has the sister of Margie, and so we're seeing them grow up together, so it's fun.
Yeah, they're littermates, so
they're
the same.
Yeah.
What did she name her?
Tina.
Tina.
Yeah. Shout out to Tina, you fat lard from Napoleon Dynamite.
Uh-huh. I can quote the whole movie. Do you love Napoleon Dynamite?
Eat it, Tina.
Tina, eat your food. The casserole dish.
Yes.
Wait,
so
I love
it's funny
Tina.
though, because Tina and Margie do the same thing. Like they both only pee on dog beds. Nowhere else in the house, pee on dog beds. Just
their own dog beds, or
their own. Their own
all
dog.
Share.
We have 15 dog beds throughout our home, but she never pees on the floor in the house. Never pees on a rug on top of the dog bed.
Just
and
dog
Tina
beds.
does the thing. Same thing. Isn't that weird?
That is weird. There has to be some.
I don't know. Something
explanation.
genetic. I don't know.
That's funny. Okay, I remembered what I was going to ask you. I ask everybody and I have an idea, but I want to see what you say. If you were a dog breed, it's not a Vizsla. So, what would you be if you were a dog breed?
Oh, you have an idea what I would be?
I do have an idea, but I want to know what you think. I've been thinking about this actually. I'm like, ooh, what do I think Betsy is?
I want to know what you think.
No.
But I'll say first, then you have to reveal. But I love Great Danes, but I don't think I would be a Great Dane. But
No.
I've always wanted a Great Dane. I would say, I don't know, maybe like German Shepherd. I don't know.
That's not what I was gonna say, but that makes sense to a certain degree.
Yeah,
German Shepherds actually are often big sissies. Like they look like they're scared, like they're scary or tough, but they're not actually.
Okay, that's kind of me. Yeah.
But you're not a sissy.
No, but I act tough sometimes, but inside I'm not.
Yeah.
But I don't know if that's German. What were you going to say?
I don't know that you're a German Shepherd. Actually, German Shepherd could work. A certain kind of German Shepherd. I was actually thinking a Greyhound.
Oh, okay.
And here's why.
Okay.
Because
Fast as fuck, boy.
Here's why. Because greyhounds are, well, yes, they love to go fast.
Yes.
And you like to drive fast cars. So I
Yeah.
thought about that.
All right.
But they're also like, they're intellectual, but they're like chill. Mm-hmm. Like you're very chill.
Thank you.
Like honestly, I was, not that I thought you were like not chill, like hyper.
Some people think I have zero chill, but I actually.
But
just
you're
usually
very chill.
Go with the flow.
Like
yeah.
every time we've ever been in, like hung out in person, I'm like always like, Betsy's so like chill.
You just can't live your life all
You're
worked
very
up about
like
things.
level. Like,
Thank you.
Which I would assume a lot of neurosurgeons are, because you have to be.
We have to be.
With
But there's a lot that aren't. I've worked with many that has zero chill.
Yeah.
Actually.
Yeah.
But
I have a sister who works in the OR, so I hear about it. Are you injury prone? That is one thing that may not fit. Greyhounds are very injured. Like they like rub something and cut their skin.
Yeah, I am injury prone.
Oh, okay.
Yeah.
I've
broken my ankle. I tripped and fell and, sprained wrist. Yeah.
Perfect.
Herniated disc.
Okay. Yeah.
Mini
See,
disc.
everybody has to tell us if they
There you
agree.
go.
I think maybe you're a greyhound.
Okay.
I
need to
love
know.
greyhounds.
Greyhounds are regal. I'll take it.
Greyhounds are really cool dogs.
Yeah.
Do you know a lot about? They're very cool.
I had a friend that had 2 greyhounds, and they were like they were rescues, so they were
from racing. Mm-hmm.
They were very, they were actually pretty chill.
Yeah. Oh, yeah. They're very chill, which
Yeah.
is also what
Yeah.
made me think about you. But I'm worried that we're not going to see greyhounds much anymore because racing is banned, I think, just about everywhere. And so there aren't a lot of, but like vet med jokes, like, have you ever seen a greyhound puppy? We're always like, no.
yeah.
And I've never seen a greyhound puppy.
I haven't even seen any I haven't seen greyhounds very much on social media.
Yeah,
to be
I
honest.
think there's a lot of greyhound rescues
Yeah,
because they rescue them from the track. But now that there aren't, I don't know if there are any tracks anymore. There's not a lot of greyhounds. So hard to come by. Neurosurgeon.
There you go.
Female neurosurgeon.
All right, I'll take it.
Okay. And I should say we're done, but I also just, speaking of being a female neurosurgeon, I know it's something you talk a lot about. But I love that is who you are. And there's not, how many women neurosurgeons are there?
So the data is probably a little outdated for now, but as we knew a couple of years ago, it's 240 board certified neurosurgeons in the U.S. for female. But it used to be 6-7% of all residents, and now it's up to like 16-17%.
Yeah.
So I think the numbers will quickly change and rise, but they've done a study in one of our journals that suggests that it's going to still take for us to be kind of up to speed to other specialties. With the percentage, it's like 50 years away from being like not a. Yeah.
We were talking about this
crazy.
today. I'm like, oh, don't forget to talk about it because I know you talk about it a lot. But it won't take 50 years.
I don't think so. I think women are intelligent creatures who are good with their hands and are good surgeons.
Yeah.
And I think that the more women that realize that they can do it and have a family, do all the things, more people like me and some other amazing colleagues of mine that pave the way that it is obtainable. And you're going to spend so many years of your life doing things, right? So do you want to spend 10 years in your 20s getting to where you're going to be where you want to be in your 30s? Or do you want to just kind of do and then maybe not be so happy? We're all good. Time is going to pass no matter what.
Yeah.
So I just think spend it doing what you love. The rest can happen. You can make it happen. We're all amazing humans. We can do what we want.
Vet med's flipped from being like, I don't know, 20% women to now 80% women in like less than 40 years. So
I don't know if I've never had a male vet.
Really?
Never.
Oh.
I don't even know.
Yeah. See, 20 years ago, someone would say, oh, I've never seen a woman vet.
Yeah.
And like I have some mentors who are women veterinarians now that I work with sometimes, and we talk about it. They're like in their 60s, and they tell me about when they first started practicing, about how they were always the only woman veterinarian in a practice, and they got basically sexually harassed all the time, just like comments about what they're wearing and how they look, and clients and coworkers and all of that, and like how it just was so different. And now there's this whole thing happening in vet med where all these women are opening practices, and practice ownership is changing, and it's
great.
A lot of women. And not to say men are bad at it.
Yeah.
I just think the introduction of a woman's perspective in those roles is really important and helpful.
Very important. I think it'll change the way we practice medicine to have different, I mean, in human med, it's a little different in vet med, but in human med, like we don't understand a lot about women's health because all the research is done on men by men.
Yeah.
And, we never experience, if you don't experience it, you don't know what it's like. And with the influx of women physicians and specialists and, for me being in spine care in sacroiliac disease, SI pain is completely exploded the knowledge base because there are women like us that have experienced it and want to look more into it and treat it and know how to treat it.
Yeah.
And
they've made it important.
Right. And the same in vet med, the more lived experience that you have and different viewpoints that you have on things will allow us to come up with different perspectives on how things should be treated. And that's both gender, but also race. And that's why diversity is really important in every field.
Yeah.
So,
and it's not good in veterinary medicine, but there's organizations trying to help with diversity in our field because it is so important.
It is. I mean, you trust people when you can relate to them.
Yeah.
And, it's important. We need more diversity in all fields, but particularly in medicine and in human and vet med, because we want people to feel safe in our care. We want people to trust us, and we want, the best for our clients and for our patients. So
I know there are such a huge Spanish speaking population here, right here where I live, and it's growing. And I don't know of any other veterinarians in the area who I speak Spanish fluently. Mm-hmm. Most people don't know that about me.
I did not know that about you.
I am bilingual. So it's a very random thing about me because I used to live in Honduras, vive en Honduras.
Amazing.
And I have a good bit of Spanish speaking clientele because I have friends who speak Spanish, so they tell their Spanish speaking friends that, hey, my vet can speak Spanish.
Yeah,
so they come.
Important. Mm-hmm.
But it keeps me up at night thinking about like all the Spanish speaking pet owners here who like don't go to the vet because
it's true.
They realize like they're not, if they don't speak good English. I mean, just like conversing to like buy something at Walmart is one thing, but talking about your pet or your own medical care is so much more complicated and harder to do.
You feel vulnerable, and it's definitely, I mean, we experience that on the human side too. Like I live in a very heavy Hispanic population too, and I know some Spanish to feel like I can do an exam and ask questions, and have staff that can help me with that, because it's really important. If you don't have that, communication barriers are of utmost importance in healthcare. Mm-hmm. So yeah. And luckily in human med you have at least bigger like staffs usually, and there's people or at least in big hospitals, translators and things, but even that's awkward. So it's nice to be able to just speak the language as the doctor. So awesome. The more that happens, the better off everybody will be. Agree.
Okay, we got on a tangent, didn't we?
We did.
It's a good tangent.
It's a good,
No, I just am so like glad to be your friend and know you and love what you're doing and excited for you. And yes, you got to come back when we open the clinic.
I'm excited.
And I need to come to Atlanta.
Future. Yes.
I know. So many good things.
We'll share in the lived ownership experience of entrepreneurial women in medicine.
It's great.
There you go.
It's going to be, it's going to be great. It's going to be good.
Yes.
Okay. If you're not following Dr. Grunch, you should. Lady Spine Doc.
Yes.
And everywhere, all the platforms, all the things. And then before we go, like what else is going on? What do you have going on? What should people know about coming out with Lady Spine Doc?
Of course, the practice, and that's growing, but I'm very excited to have recently I've become very passionate about some of the things that we talked about and healthcare creators, all kinds of medicine, human, vet, med, all levels of providers, but just like really kind of flooding the feed on social media. We need more educated healthcare content creators to help empower ourselves, because I think we feel so vulnerable online, and rightfully so. But I think the more voices, evidence-based voices we have, will empower people to be able to ask the right questions to their healthcare and make better healthcare decisions. So one of my passions is really getting more creators online, and getting over like, oh, where do I start? Or, how do I start? Or I don't want to burn out. And so I have started a coaching for healthcare content creators. It's called Medpreneur Academy, and am writing a book. I know, I didn't tell you that.
No.
And
are we allowed to know what the book's about?
The book is about brand building, and basically just kind of like a how-to guide on becoming a content creator or building your brand. I mean, I think brand building, it sounds cringy, right? Like, well, I don't need a brand. I'm a doctor. Yeah. But that is what you are, whether or not whatever your employment model is, your person, your profession is your brand. And it's so important for making that accessible to patients. And I think it's really cool. I mean, you've experienced this too. People come and see you, they trust you immediately, right?
Yeah.
And
they feel like they know you.
They know it's this parasocial relationship. They do. You put everything, and that makes me feel like I can take better care of my patients, because that trust has already been established, and it allows me to become deeper involved in my patients' lives and give them better outcomes. So I am very passionate about making sure that people, physicians, healthcare providers, vets, dentists, whatever, feel comfortable creating content in an ethical way and in a way that's sustainable. So Medpreneur Academy, you can check that out. And then my book, hopefully, maybe in the next 6 months.
Okay.
Maybe. I'm hoping. I'm editing it now. So that's coming soon.
Exciting.
Yeah, I'm very excited.
Oh, I can't wait to see it.
Yes.
Okay, well, make sure you follow her and check all of that out. And I will see you next week on the Dr. Molly Says podcast. You can listen to us. If you're watching on YouTube, you can listen on Spotify and Amazon. And if you're listening, you can watch this episode too on YouTube. See you guys.
Bye.